Mm-mm. No, I'm not going to record. It is produced. It is produced with herbs from our land, that is Nigeria. It deals with oxidative stress, which is the root cause of every illness or diseases, which is the reason why it is potent in a number of health challenges. I mean the reader range of products. Function of the active ingredients includes effective for all normal wellness in the body. It also mops up oxidative stress. Strong is also a strong antibiotic and anti-malaria. It has anti-malaria properties. Effective for managing high blood pressure and diabetes. It's also effective for all kinds of pain. It boosts immunity and is also a catalyst to other reader range of products. Great for desertification and much more. Or I'll be talking about each of these products that are available. Like I want us to know that there is no sickness or diseases in our body that has no connection with oxidative stress, which makes this product very potent. Health products includes, these health products includes Restore, that is Reader Restore for women, which restore hormonal balance. This with menstrual pain, correct menstrual anomalies, enhance libido, increase chances of getting pregnant. And I quickly want to say here that the Restore is one of the things that make me to practice, to have interest in practicing, because while in Nigeria, I've used this product for people right here in Nigeria and who have married for so many years without conception, who has gotten children. Next to Reader Restore, we have Reader Fire for men to help improve sexual performance. It improves libido too. It helps with management of prostate cancer, improves men's reproductive health and sexual performance. Next to that is the fertility pack. We have the fertility pack, Reader's Restore, Cleanser, Reader Bitters, and sometimes we had Cuminous oil. We also have the one that deals with with fat, which is fat burner. It is designed to keep your body fit and in top shape for detoxifying the body, managing weight, and burning unnecessary fat. It also supports healing and gaining and control weight gains. It helps to speed up metabolism in our body, effective in promoting kidney function and aiding digestion, and so more and so on. The cleanser, like I've said, is powerful, and it can be used for both male and female. It strengthens the immune system. We also have the Reader Balm. The Reader Balm, when you want to experience calm you use the reader balm. It's quick, active herbal blend designed for quick relief of body pain, nasal congestion, inflammations, cold, and catarrh. It is useful for joints and rheumatoid pain and dislocation, effective for quick relief of cold. It contains anti-inflammatory property, which is effective in treating all manner of skin condition, such as eczema, useful for waist, back, neck, and chest pain. Another product here is another thing that this product deals with is the causes of stress, oxidative stress, diet, medication, treatment, air, water pollution, fast food, stress, lack of good nutrition, alcohol. When we have this type of seminar, we want to let people know that you need to avoid all this. And even when you find yourself into it, the reader product go a long way to help us. For now, I want to hand over for the doctor. God bless you.
Thank you very much, ma. Thank you, Grandma. So we heard her, everyone. In addition to what she has said, this products are also approved, FDA approved, ISO certified, FDA approved. So I'm not going to go deep into much about this. I will allow Dr. Erekosima to take over the floor. So a little bit about Dr. Erekosima. She's an amazing individual. I'm going to stop sharing my screen, everyone. Okay. So Dr. Eriks, I met Dr. Eriks about very shortly, about 2 months ago, thereabouts. And we just started talking over the phone, and she offered to tell us, to join us in having this conversation, to encourage people about, so this is what I know a little from my interaction with her. She's a multifaceted leader. She's blending her over 10 years of medical expertise with honors in pediatric nutrition from the University of Boston, Massachusetts. She's also a lecturer on early childhood behaviors, which positions her as a positive resource for families. Dr. Susan is blessed with a loving family. She has been married to a unique and supportive husband for almost a decade, and they are proud parents of a dynamic son. Dr. Susan's remarkable blend of professional expertise makes her a respected voice in our community and the world at large. Today, she's also a key person in this organization, the Grey Monday, the maker of this reader product that Mama has spoken to us about. She knows, she's involved in, maybe not in the production, but she's one of the authorities there. And so that is why she's going to be having the floor to tell us more and tell us the relevance of this product according to the medical aspect of it, not just, taking herbs without measurement and all of that, which is a lot of people's concern. No measuring specification, no guidelines around it, but she's going to break that all down for us. And while she's talking, I would like us to also prepare questions. We are going to soon have the floor to entertain questions, comments that we might have as a result of this meeting. I want us to be very open-minded and expectant. It's going to be very promising. So Dr. Susan, please, over to you. Thank you for joining us tonight.
Thank you, Mrs. Olatiboso. I'm very pleased to be here. I hope that everybody can hear me, please. If you can, just give me a Nigerian flag on the chat box if you can hear me. And if you can hear me very loud and clear, give me the flag of the country where you are. So mine is going to be red, white, red, because I am presently in the North American side of Canada. So I'm happy to be here. Thank you, Pastor Mrs. Oluru Moroti, for this invitation. I am very honored to be here, and I'm very glad. One of the reasons why I decided that I was going to speak here is because I saw a daughter who is passionate about her mother's business, and that reminds me of the relationship of myself and my mother. I introduced my mother to the reader business, but she got into it before me, like fully into it before me. And so she literally dragged me, even when I didn't want to be inside. And I'm so excited that I'm here. And I am glad that tonight we'll have some interesting facts, that some things that we know already, some things we're going to improve on from what we know, and why we need to take this course as the better part of life from this time henceforth. However, before I continue, so every boss has a boss. So I have a very, 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 like, she's as very as that, a very senior boss here tonight. As a matter of fact, it's midnight where she is. She traveled all the way from France to the United Kingdom. She had a stressful flight, which was delayed for some hours, but she still made it a good honor for us to be here. She is one of the executive managers of the Green Mondays, the global synergy, which is the body under which Green Mondays fall in. Please help me welcome Dr. Fumi Aino. She's quiet inside here, but she's here. I'm seeing her. She's present. She's shown me that she's present. Dr. Fumi Aino, thank you so much. And I'm very glad because on your shoulders, we can soar. And that's helping us because she's a very much senior colleague. Like, I'm sure she graduated before I even thought of writing maybe primary 3 exam. So she's that much, she's that much of a boss. And the fact that we have medical doctors now in the herbal aspect of medicine is actually giving us more confidence that there is more to the medical science than we knew. So I'm going to just continue from where Pastor Mrs. Olumoroti stopped. I'm just going to pick 1-2 hints from the oxidative stress, and then we'll build it up together and why we want the reader range of products in about 20 minutes so that we can have time to take questions. So oxidative stress is basically an imbalance of free radicals and antioxidants that cause cell damage. So we have free radicals. Their job is to, they're unstable atoms. They just go ahead, cause trouble in the body. Now, why the antioxidants are chemicals that they interact with this to neutralize them and prevent them from causing damage. So one person's job is to cause problem. Another person's job is to attack the problem. But where the oxidative stress comes in is that there is an imbalance. So instead of the one that instead of the one to kill the problem should doing his job, it's having an imbalance. The one that is causing problem is still knocking at it and fighting it. Problem has more power than the one that is supposed to. It's like saying that you want to quench fire, but you are now pouring gas into the fire. So that tells us that the fire is going to increase and burn up the body. That's exactly what the drama between the free radicals and oxidative stress. So what are the things that causes oxidative stress? As rightly said, we are stressed up, the nature of our job, especially in this aspect of the world where we are now. Many of us are working 2 jobs, some 3 jobs. Some are working 2 physical jobs, 1 job online. Some are working 2 jobs online, 1 physical job. Then you have that are waiting for some pounds and dollars. So you are doing a whole lot to your body system to be that up. Now, in trying to do this, what are we doing? We are taking in more alcohol to jack the sugar rush up. We're taking in more carbonated drink. We take a lot of carbonated drinks. We take a lot of coffee. Now that we're getting into winter, where it is cold, cold, cold. Like if you're in Canada, you're going to run the 9 months marathon of cold. And so you're taking up everything to keep you as warm as possible without remembering that you are bombarding cells. And these cells can only but do like this. Help me, oh, help me, help me, help me. I don't know where these people, they carry me go. And so because of all that, the alcohol, the high intake of the drugs, the high intake of smoking, air pollution, stress, which is the most, I think I call stress the grandparent of all of them. Now, all of these things join to break down the body cells, making the body cells to get damages and start shouting for help. Now, when these things have become accumulated in the body, what do they now cause? They bring about cancer, which is very common in this area of the world where we are, Alzheimer's disease, Parkinson's disease, dementia, mental illness, mental breakdown, your stress, every little thing. Oh, I think I'm mentally stressed. I'm like, okay. I'm like, someone's like, look, I'm just stressed. Of course you are stressed. And that's not because sometimes the stress is not even from your physical body. It's the cells that are down. So they are messing up the physical body. They are messing up the mind. They are messing up your joy. They are messing up everything. And then you start having the rheumatic pains, arthritis. And you're like, I'm just 30. Why am I having arthritis? I'm just 35. The doctor is already talking about menopause. Yeah, because the body is receiving much more than it can handle. Oh, I've had 2 children before. What's the doctor saying? But my sperm count is 0 or my sperm count is low. Yeah, the stress you're having now and the stress you had at the time when you had those kids are completely different. So the body is worn out. The body is receiving a lot of trouble than it can naturally handle. So how do we combat this problem? Now, a lot of us are used to the medical science. I'm a proud product of the medical science, and I'm happy that I'm in the medical science. However, I have an interesting background. My maternal grandmother used to be a herbal doctor. Now, herbal doctor is not the one that puts chalk and all this stuff. No. Now, she's the herbal doctor. From my knowledge of her when I was growing up, I used to know that people booked appointments to come see my grandmother because they could not have babies. They booked appointments to come see my grandmother because they had toothaches. And my grandmother would go to the room, prepare some herbs, some leaves and wood and put them together, and she'll give them. And after some time, everybody's in my house rejoicing, either because there's a pregnancy or whatever the issue was is gone, or they said the woman went to the toilet and urinated blood. And I want to believe that in that time, that knowledge must have been fibroid that came down, because just said she felt like she was in labor and she went and it was just blood that came out and the thing came out like a ball. And I'm like, okay, bring that to present day medical science. What is the thing that can come down like a ball? Is it either a cyst or a fibroid? And so that began to make me more inquisitive in the medical science. So as I got into medical science, I started reading about herbs, nutrition, how that you can take everything natural and be better and live healthier. I'm like, oh, this was what my grandmother was doing, huh? So I see why there's a doctor in her gene, and I see why my own interest in the herbs when I was told about it. So I started making inquiries because at this time, my mother was having a very terrible experience. And now I'm going into the reader range of products. My mother started having menopause at the age of 40. At the time, I was in the medical school. Yeah, like 40. And I'm almost there. I'll be there like maybe 1 year and some months. I'm like, oh my God, this is going to happen to me. So she started having menopause at the age of 40. One thing was very significant. Her other sisters had menopause at the age of 55, 60, 65. What is the difference in her own? So my mother became a widow at 28. and had interesting in-laws. So she started, and she was pregnant at the time she became a widow. So there was a lot of stress having to raise 4 children, 3 outside, 1 in the womb. And then all the 4 of us decided to toe the medical line, and she was doing it alone. So I remember all the stressful things my mother had to do to make us get to where we are. And all of that brought about early menopause in her body. Now, I didn't get to know all of this on time, but I started making researches. I started asking why. And so there was no drug we didn't give my mom. My mom is, I think, just about my size, if not slightly slimmer than I am, but I'm about my mom's height. So she's not a big person. But my mother, when menopause started, will be like 4 times my size. If she takes any food, her whole body system would change. Her eyes will swell up. If she calls you on the video call, it's only by her voice that you will know that she was the one. So there was no medical drug I didn't give to her. I went to my consultants. I went to everybody. I asked everybody I knew, what is causing this? I said it's menopause. I'm like, so do you mean there's nothing that she can take that will balance her system? She struggled with this until she clocked 50. And then in her early 50s, it became unbearable. So I was on the call one day lamenting, and somebody just walked into my office, a patient, interestingly. And she just talked to me, oh, Dr. Rex, I heard you lamenting and all. I said, look, my sister, I'm tired. Like, God, please, my mother cannot even die now because that woman has not even enjoyed. So why would all this trouble, after all this trouble, we should now be going through this one in the name of menopause? He said, Dr. Rex, I know you are a medical practice and all of that, but there's something I want to introduce to you. If you try it, I'm like, herbs, I beg, forget it. Because we were tutored in the previous medicine that herbs were rubbish. Because there was overdose, there was no range, there was no calculation, there was no duration and all of that. So I'm like, I can't deal. And she's like, okay, you know what? Just try it. If it works for your mom, I'm not even asking you to come do business. If it works for you or your mom, start prescribing it to your patients. When your patients need it, just call me. I'll supply it. I'm like, okay. So I had tried other herbs, so they didn't work. So she gave me, I wanted to buy. She said, no, she's going to gift me. That I should try it and give her the feedback. I said, let me pay. She said, no, if it works, then she will charge me for the next one. I said, okay. So I webilled it to my mom. My mom is presently in the eastern region of Nigeria. So I sent it to her. And after confirming she received it and trying it, for 4 or 5 days, my mother now called me and said, well, I don't know what kind of a doctor you are. You wait, Mama, hold on. It looked as if everything dissolved in her body. And that was the beginning of my mother's healing. All the symptoms stopped. All the body swellings, all the food she normally would eat, she could eat them. Redirect products. I got the Restore again. I tried it on another patient. Then I started trying it for other patients, like Mama Olumoroti said, patients with infertility, and it started working. Then an interesting part of it, my sister used to be really obese, pretty obese. And that's a situation where your assist is not coming at all, or you see this month. Guess what? In under 3 months and barely 3 weeks, the cycle was corrected. This is something she's been dealing with for over 50, at least for as long as I've known my sister having menses, for over 15, 20. And that's when. And so what exactly is in this product that is making it work? And then I started realizing that every single thing in the Reader range of products are roots, herbs, natural leaves from where we come from, Africa. We are one of the richest and greatest countries in the world as a whole, not just in Africa. And our Creator blessed us with a lot of natural herbs that have been doing us well. It's just that we have not made research into them. However, thanks to the Green Mondays, the reader range of products was better. And they started going to make research into these herbs and started finding what herb is for what. Is this herb for this? This one is for this. And then a lot of clinical trials started going on. Clinical trials are what we do in medicine before you release a drug. So we started doing clinical trials, herbal trials, clinical trials, herbal trials, boom. And then we hit it and started getting all the herbs that was meant for each of the troubles. And I can tell you, I can boastfully tell you that the reader range of products is still the best herbal line of medication in Africa at the moment. I have 1,010 examples to give if time will permit us, but I'll just give you a few. So I had this client, at the time he was 70 years old. We call him Baba Fire. Baba came, oh, Dr. X, my prostate is, I'm feeling this way. I can't know. He didn't even know it was his prostate. I'm urinating excessively. My doctor said I don't have diabetes. My sugar level is fine. My HbA1c is fine. But why am I still urinating frequently, excessively, every time in the night? My waist, my back. I'm like, okay, I examined him. I said, Baba, have you checked your prostate? He's like, no, that is just, he has only his wife. He didn't do naughty things as a boy. He did know some naughty things as a boy, but after he married, he's been married for over 50-something years, has grandchildren. So why be talking about anything about his? I'm like, well, I have to check your prostate to know what the issue is. I had studied the reader fire to know it. Baba was my first client for reader red. See, interestingly, Baba is a chemical scientist. He's a lab scientist, retired. So Baba is like, oh, Dr. Eres, please, all these herbs. I'm like, Baba, if after taking it for 3 months, he will not like to combine the two together because he has not tried it before. I'm like, okay, no problem. Start with the reader bitters. He started reader bitters alongside the reader fire. In 1 month, but I was expecting
Yeah, network on Dr. Eric's side is we really apologize for that, please.
okay, I'm coming to your office. He said, Dr. S, guess what? I'm like, if this thing is working, I've come down to a certain range. And immediately we checked the results. It had gone lower than normal. I'm like, what? It's already lower than, I said, this is 1 month. I'm like, Baba. To mess up your system. He's like, no, he has to feel with chair for reader fire. In fact, that's the only thing Baba talks to you. He just say, okay, go and meet Dr. Erek, tell her your results, go and check your prostate. After the results, come and buy reader fire. And this is Baba's 73rd year. Or is Baba 73? Is it? No, 74. He'll be 74 by this November. And Baba's prostate, if you see, Baba is not just having a good prostate, he's looking healthier, he's looking better, doesn't have the complaint. And Baba said that Mama said he's firing better. I don't know what Baba is firing at 75 or 74. But if Mama can testify, who am I to put my mouth inside their business? Then the reader fat burner. You see, when people look at the name fat burner, I was even discussing it recently with the chief executive officer that this reader fat burner, you sure will not put another name to it? Because when people hear fat burner, most of the thing they always hear is lose weight, weight loss. But the interesting thing about it is that it's not just solving the job of the weight loss, which I'm a testimony. I regained this weight when I got into Canada, and that's for a reason, because okay, so I'm trying to conceive for another baby, and I've done everything I think I should do right. And I went to see the gynecologist. And the only thing the gynecologist says is that my weight is too small. I'm like, oh, really? Really? And yeah, because my weight is small, so it's not helping my hormones to balance well. I'm like, okay, so let me pull up the weight back because I dropped the weight from, oh, I wish I can share the pictures. I dropped the weight. You're welcome, baby. Yes, no, for your hand. Sorry, please. Yeah, go ahead. So the fat burner doesn't just do the weight loss solution. It also burns up excessive fat in the body, which comes as a result of the high cholesterol from the kind of chickens and pork and meat that we eat in this area. Remember, in this area where we are in the world, we eat a lot of things in the cans, in the tins, and many of them contains fat. Now, the beauty of the Vida range of products is that it took us back to our roots. And everything you are taking is herbs and is dissolving them, it's crushing them, it's balancing the body cells to normal, and you will not just only get out of that problem, but you're looking healthier, you're looking younger, you're looking prettier, you're looking sound. If you see my mom now, you think she's like 39, 40, because she's slaying at 59. She'll be 60 next year. And there is not, in fact, when I was leaving for Canada, my mother said, first thing you will do for me, just give me 24 bottles of Restore for myself. That's for her alone. I don't want to do with 24 bottles. She said no, because she doesn't know when me and my business people will remember that the next one's now say this one is for my customer, this one is for my customer, so that she can be looking at the Restore like this and knowing that she'll be looking younger. Then the Reader Cleanser, that guy is a complete detoxifier. The Reader Cleanser detoxifies you from every junk that you've taken. So I call it the everyday meals, like my everyday guy. So you take, like you go for parties, you have a visitor, you have family members and all of that. The next thing is just one capsule and it washes everything. It's like it washes your sins away. Let me put it that way. So it cleanses you of all the impurities that came into the body. And now what the cleanser does is not just to detoxify you, but it heals the damaged cells. So the cells that got damaged, it heals them. You had arthritis because of the cell damage, you start receiving the cell healing from it. And now all of this would go together with the Reader Bitters, which is the commander-in-chief of all of them. Now, the Reader Bitters, the beauty about it is that it is not just completely herbs and completely roots. The taste is fine. So if you can eat bitter leaf soup, and if you are, that can stop that, please. The water is too much. Sorry, please. If you can eat bitter leaf soup, if you can eat if you're from the southeast and you can eat this stuff we call utazi, trust me, you can take the Reader Bitters because it is less bitter than that. You can have it. In fact, one of my interesting bosses always does something very funny. So he's taking a soda, he takes 2 cups of the Reader Bitters and pours it in. I'm not saying you should try it, and pours it inside it and drinks it. It's like so that as he's drinking the Coke, the Reader Bitters is washing everything alongside. But you know the beauty about the Reader Bitters, you start having instant repair. You see people who have skin infections, sores, wounds, diabetic patients. I'm privileged to have held my hospital's diabetes in Nigeria, diabetic and hypertensive clinics for 6 years. In these 6 years, all my patients that took the Reader Bitters, Reader Cleanser, Reader Fat Burner did not just have excellent results in their sugar levels and their BP levels, but also had these results and they never had a rise anymore. Why? They were consistent in taking their medications. We have done in the Reader range of products is that duration you can take and for what kind of medication. So you're not saying, oh, I don't, it's just a bubonic kind of thing. It does this one, it does this one. But yeah, we have what it will do for which of it, for what time, what do. You see, as small as that balm, my son and I come from, okay, I come from an asthmatic family. My father is asthmatic. And I happen to have what we call allergic rhinitis. So this rhinitis is an allergy. Any small thing, my nose can I can't tolerate cold weather. I'm always on the face, choking because of any smell. And it just some because there was no antibiotic I wasn't giving him. And that was the year I got to know the reader range of products at the time he was 1. And so when she introduced me silver bed, we have this. She said, just try it. And it was once consistently. I was playing around the balm, not every day. I just put a little in his nose, smear a little on the bed before he lays down. And up till this moment, as I speak to you, my son and myself have not had any nasal trouble since then. And I'm beginning to ask myself, like, is this me in Canada? Like, I can tell it because that's one of the things I'll say, no, I'd rather go to Australia instead of Canada because of the cold. Now, but here I am, I'm tolerating the cold. I go out, sometimes I don't even wear a jacket, sometimes I don't wear a head mask, and I can inhale clear air. That's because of the natural range of everything that we're showing you. So tonight, I'm just encouraging every one of us, please, come on in, have a taste or a feel. If you're not sure which of the range of products you should have, Pastor Mrs. is here, Sabusaya is here, and of course, you can always get across to me and we would let you know which of them we feel is working for you. Can you use these drugs with your normal American English medications? Of course, yes. The interesting thing about it is that it can be taken together. We usually say 30 minutes before you take A, or 30 minutes before you take B, or 30 minutes after taking A or taking B. It's very, very interactive. No one is doing harm to each other. And for over 5 years and running, we've been having amazing results. If you check our website, it's not a scam. It's not fake. Before I left Nigeria, I made sure that the specialist teaching hospital I was working with, all my consultants that were available bought into the reader range of products. And now it's in all the pharmacies in Ikorodu. Those who are coming from the Ikorodu region, those St. Raphael or Ikorodu, the whole of Ikorodu now, reader range is everywhere. It's in all the hospitals. It's approved. And if you check on the internet, Sabusayo is going to tell you about that. It is there, written there. If you go online, I was showing Sabusayo something. Bitter leaf capsules. Our bitter leaf now has been grinded and put in capsules and is now being sold in the years. And I think for about almost $40 or 50 something dollars, if not more now. This is at the time I know our bitter leaf. Now we have now helped you to merge this bitter leaf together into products that will not just help you get better, that will not just heal the sickness that you are having, but will also give you a longer lasting life, all on the natural life. So buy into it, come into the reader range of products and enjoy a wonderful life. Can children take it? Yes. The only people that are not allowed to take it are the pregnant women and the breastfeeding mothers, but they can use the balm, they can use the disinfectant liquid, they can use the soap, they can use the lotion. But children 2 years and above are approved at this time to take it. It's ISO approved, halal approved, NAFDAC approved, and yes, it is presently now in the United States market, in the United Kingdom market. It's almost on the Canada market, but it is all around Canada and in so many other countries of the world. So I'll give the forum back to Mr. Latubosu, and then we can take questions afterwards. Thank you so much once again.
Thank you, thank you. Please let's appreciate Dr. Eric, like Dr. Susan. We can let's show her some love, react with a clap. I just want us to appreciate the wealth of knowledge.
Welcome, God bless you.
To us. Thank you so much, Dr. Susan. Yeah, this has been very, very interesting, and we appreciate what you have explained to us. This is a good time for us to ask questions. If you have any questions, you can either put it in the chat or unmute yourself and go straight to talk. We'll have we should be rounding up on the dot of 8, 7, depending on your time zone. We don't want to keep us here, but I like to encourage us to, ask questions. We have the floor now to ask. I have a question, Dr. Susan. This is what I want to know, Ma. How do you, we've explained, you've told us that this medication, these herbs that's been portioned in a way to address certain, ailments, certain concerns. Is there can it totally heal? Do we have a time frame, say maybe after 3 months or 90 days I use it, I don't have to go back to it, or do I have to keep going back to it? Or how would you advise on, continuous usage of that medication, of the herbs?
Okay, so I'll answer it by saying first that every ailment has its different way of managing them. Now, for someone who has hypertension, knows that he has to take his or her medications every day until you get to the point where your doctor tells you, oh, okay, it's down now. You have to take alternate days, maybe like Monday, Wednesday, Friday, or every week, or once in 2 weeks, depending on how well the blood pressure is controlled. So depending on the ailment, we'll now tell you how often you need to take, what duration you need to. However, the baseline, which is the reader betas, is the one that helps you to keep an everyday balance. So you can have it every day. There's no overdose in it. That's the interesting part. There's also no overdose in the cleanser, because those two are your major detoxifiers.
She's going to come back on. We do apologize for that.
So we don't have another overdose of theta. We may stretch to say, okay, instead of once a day, but some people may say, oh, just once a week, depending on what the challenge is. Somebody that has high blood pressure takes herbal medicine with high blood pressure medication. Yes. So yes, you can take this medication. First time, you can have it 30 minutes before you eat, or vis-a-vis. If you're taking your doctor must have told you to stick to mornings if it's mornings, or stick to evenings if it's evenings. And if you're morning and evening, have a specific time band. So if you're taking your BP medication for morning, you can have the reader range of products in the evening.
Okay. Okay. Doctor.
Or if you're on the time balance of morning and this, I usually counsel them, or 30 minutes after the reader range of products. Yes, I have seen it reverse diabetes over and over and over again. We don't have a lot of time tonight.
Yeah, this is the very important part of this meeting, and I'm sorry, I do apologize for this breakage. But I
together on how reader range of products would, and would tell you how the reader range of would have loved to be in this meeting this night, but it's his wife's birthday today, so in the Nigerian time, so he's like doing the surprise stuff and all of that. He wanted to give a testimony of how the reader beaters and the reader cleanser helped his sugar level to return to normal, reverse the sugar level. And at the moment, he's not on any sugar level medication. He's just taking his beaters and his cleanser, and his sugar level has never gone beyond 90 for fasting sugar. And so, yes, it can reverse diabetes if you are very stringent with taking it.
Okay. Thank you so much, Dr. Eriks. Can you quickly recap what you said about
You're welcome.
You cut out, there was a break in the network when you were explaining it.
Oh,
just briefly, yeah. The blood pressure question.
Oh, I said for the blood pressure medication, I'll say you can take it 30 minutes before the reader medication, or take the reader medication and after 30 minutes, take the blood pressure medication. It doesn't disturb each other. It can be taken together actually, but I'll say for a first start, because some people naturally will feel different if they take two different types of medication together. So for the first start, I'll say give a 30 minutes time band. Then if your BP medication is morning and night, then you can have it 30 minutes before the morning, 30 minutes after the night on. I usually recommend some of the reader range of products to be at bedtime. Many of them are bedtime medication because that's when all the cells feel that they want to be at work. And that's all the time that we can have medications to do their job at its optimum best.
Okay, so there is a question here that says, what lifestyle changes are recommended when taking the range of products?
Okay, so I would tell you as medical truthful as it is, and as herbal truthful as it is. You have an open wound, and you want it to heal, but you are still using knife to cut it open. So you are taking medication, and you are still opening that wound though. That's exactly what happens when you're taking your medication and you're not doing a lifestyle change. So lifestyle modification is a must for any kind of medication that you are taking. You must watch what you're taking as regards cholesterol. You must watch your caffeine intake. You must watch your sugar intake. Please, the height at which we're consuming sugar now has become overwhelming. Sugar is in almost every food that we eat. It's in rice, it's in beans, it's in potatoes, it's in oranges, it's in all the fruits practically, you know. Even the lemon has some level of sweetness if you're having a sweet lemon to take. So we ask that instead of taking the raw sugars that come in the carbonated drinks and the juices, do everything naturally. Then we ask you to exercise. So there's something we created in the Reader Range of products. We do an everyday check and balance where you are expected to take a certain quantity of water per day, have how many number of walks, and you can put it up and mark yourself and have a drink of water that contains a lemon in it, either lime or lemon, just a squeeze here into it. So yes, do your lifestyle modification, do your exercises, burn up weight, go and check your BMI, ensure that you are within your weight range, especially, of course, those breastfeeding are not in this line because you're doing a lot with your baby at breastfeeding. But once you're off breastfeeding, yes, you can now start cutting down on your carbohydrates, your starchy meals, your oils. The chickens, you know, on this side of the world where we are, contain a lot of oil. So instead of doing the vegetable and granite oil, which I am completely against as a naturopathist like grandma, I would prefer and I strongly recommend that you stay on the olive oil, which has proven to be the best standing oil for health. You don't even need so much of it. Just a little of the olive oil is spread out. So run from the vegetable oil, run from the groundnut oil, stay on the olive oil or the sunflower oil if you cannot afford the olive oil. Olive oil is still the best. Or you use your shea butter if your mouth can tolerate your shea butter in your food, which is still very, very healthy for us.
Wow.
There's too much sugar in Canada. Yeah, Canada is worse. I think we have more than the US. I thought the US had more sugar, but I think Canada is a senior brother now in sugar.
That's interesting. Thank you so much, Dr. Susan.
Oh yes, we can use olive oil to fry plantain. So what I do, because I have a toddler, my son is 6 years old, and I know that he still needs some level of oil in his system than I do. So I use the olive oil to fry the plantain. But guess what I started doing now? We have switched to the air frying, which is better. Interestingly, when you air fry, I don't know where the oil now comes out from.
From the plantain. Yeah.
We'll not put olive oil. That's not that's air fry straight. It will taste dry and different. That is actually the idea. To pull out, to suction the oil and give you the normal taste. So yes, you can use olive oil.
Yeah, thank you. Wow. This has been a very amazing meeting.
Anyway, everything I use olive oil. I've not touched granite oil in maybe 16 years or so.
Yeah, thank you, Dr. Susan. Yeah,
hello? Okay.
Yeah, we can hear you. We can hear you. Thank you. This has been very informative and productive. I believe it's a very good use of our time. Thank you for everyone that has participated in this meeting. Thanks for all the questions. If you do have more questions, I think, let me quickly share, Dr. Susan. If you don't mind, can I share your contacts with the participants, Dr. Susan?
Yes, please. I'm easiest to catch on WhatsApp. Phone calls scare me.
1 moment. So we have You can also reach out to Mama
I'll
as well.
definitely respond.
Can you see the contact on the screen? Can you see my screen, please?
Yes.
See it.
So yeah, those are the contacts. If you want to, if you have more questions, the products are available on Etsy. Unfortunately, I don't have the Etsy link, and I know we might not be able to pick on the link on the slide, but I can drop the link on the chat for people to check
Yes.
out. Yeah, we also, though for Etsy, we just have a limited number of products there. And really, we don't want people to just go to Etsy and just start getting what they want. We want there to be a consultation. We want people to
Exactly.
we want to have a conversation so that we'll be able to guide you on what is necessary to deal with whatever that you wanted to do. So it's best to reach out on this WhatsApp numbers. That's Mama's number, the 240-936-3911. She's available on call and she's available on WhatsApp. And good as it is, the products are here, like she said, it's been distributed in the United States, and it's really available for you if you want it. But any questions to address any further concerns, please reach out to the numbers on the screen. I believe it's a good time to end this meeting now. Thank you all for your participation once again. I appreciate your time. Yeah, we have 20 people. That's amazing. Thank you, Mrs. I know we are grateful that you are able to stay true with us despite the time that you have, midnight time, your busy schedule and all. Thank you all for joining in, and we hope to continue to live a healthy life and a more prosperous life here, wherever we are, in Jesus' name. Amen.
Amen.
So,
Amen. Thank you so
Thank you,
much.
Doctor. I'm very,
Thank you,
very
Grandma.
grateful. Thank
We
you
appreciate
for
you
the
so
regard
much.
you have for
Thank you.
me. God will reward
Thank you.
you amazingly
Amen.
in Jesus' name. And
amen.
I also want to thank
Amen. Thank
Dr.
you.
Aina.
So much,
You
everyone.
have always been there, Dr. Aina. I'm proud of you too.
Yeah.
God bless you, ma.
Yeah. Doctor, I know you can speak with us. You can just say if it.
Yes, so.
Yeah.
Charlie wanted to say, Dr. Aina should give us the closing address.
Yes, please. Like,
Okay.
Okay.
already fell out.
Dr. Aina, please,
Okay,
over to you,
Yes,
ma.
so.
Can you hear me? Good morning, good afternoon, good evening. Sorry, I won't be
Yeah.
able to share my put on my
No,
video.
we understand. No
Well,
problem.
first of all, I want to congratulate Pastor Mrs. Olumorosi, and I'm very inspired by your daughter, the support she gave you. And thank you also, Dr. Rex. It's really been a good time. Just to say that I know that people sometimes ask, how come you're a medical doctor, you're involved in this? I mean, personally, it was one of my postgraduate courses abroad was where I really got the gist, let me put it, about oxidative stress and antioxidants, and that sort of positioned me. But also looking at the reader range of products, doing my own personal research, because when I first encountered them, it was with I would say some amusement, like okay, but after using them and doing some personal research, I saw that it made scientific sense. Also, the reader range, especially the bitters, is the only natural product in Nigeria that has had a complete clinical trial. And the clinical trial, the results were statistically significant, that verified the claim that reader bitters helps in the management of hypertension, diabetes, and arthritis. This was a randomized, controlled, placebo-controlled trial. So, I mean, when you interact with this product, you're interacting with a product range that the manufacturers went to great lengths to get all the appropriate certifications, approvals, just to make sure that what is being brought to the world is safe, qualitative, and effective. So thank you all for listening. The reader range of product, I mean, we have thousands of testimonials, thousands of feedbacks from satisfied users in over nearly 20 countries of the world. So they're not just herbs picked here and there, and if you research into the ingredients, you will see that actually there are so many studies on even the ingredients. So we have an amazing range of products here, and they're very valuable to health. I won't go into my testimonies, but they're quite a few. So congratulations for organizing this. It's very good, and thank you for all the participants. Take it seriously and try the reader range of products. Okay.
Thank you, Ma.
You're welcome. I wish you all the best.
Amen. Thank you. Thank you, Ma. All right. Thank you, everyone.
Thank you.
Thank you for your time too, Mama Olumoroti. Thank you, Dr. Erex. Thank you, everyone.
Thank
Enjoy the rest of your evening. Yeah. Bye.